Experts say they're bracing for a big spike in patients at local hospitals in the coming week. As the coronavirus crisis continues, how are local hospitals preparing for a potential surge?
Chief Medical Officer with Dignity Health Southern California, Dr. Testa, joining us now live via Skype. Doctor, good morning. Thanks for joining us. And what's your current situation in terms of supplies and ventilators? How do you feel right now?
So right now, we're doing pretty well. We have the supplies that we need, but we're watching it really carefully because we certainly haven't seen the big surge yet here in Los Angeles.
And LA Mayor Eric Garcetti has said recently that he thinks that we're about 7 to 10 days behind New York. Is that what your estimate would be from what you're seeing at the hospitals?
That's tough to guess.
Right.
I think the next week is going to be very telling. I think every week gives us more information. So I would just have to go week by week and see how it goes.
And doctor, we were talking about the situation in New York. You got a lot of people very close together in terms of living space. You have subways that are used a lot. Do you think that's part of the problem in New York, or is it just we just haven't seen it yet?
I think we have a geographical advantage in living in Los Angeles. We live most commonly in smaller housing complexes or homes opposed to a lot of apartment buildings. And then also we tend to be in cars a lot more opposed to public transportation. So I think that geographical advantage has been helping us. But I will say, I think our city has been doing an incredible job of sheltering in place and really locking down our activities.
And what are you seeing at the hospital? Are you seeing an overcrowding, a lot of people coming in trying to get tested?
So we're seeing two things right now. We're seeing a decrease in the number of a lot of the common complaints we'd see in the emergency departments and hospitals, which is good because it's decompressing the EDs. What we are now seeing is an influx of people coming in with respiratory complaints, which is probably all COVID-19 at this point. But I can't say that the hospitals are inundated yet. We're just seeing a steady flux of these patients coming in.
Talk about the lack of testing. It's been a problem from day one. How different would the situation be if we had access to plenty of tests?
So, the testing is, we could go around and around on this. If we have more tests, we can identify more patients and we can really get them into isolation. A patient who knows that they're COVID-19 positive is going to handle their isolation differently than a person who thinks they may be positive or a person who may think they just have a flu. So the more testing we can get our hands on, the better.
A lot of good information. Dr. Testa of Dignity Health, thank you so much for being with us this morning.
Thank you, sir.
Thank you.
Meanwhile.